Our nurses union at Denosa is this morning set to give an update on the state of health in Gauteng. The provincial structure of the union says it will also outline a way forward for its members. Union leaders intend to outline details regarding the state of finances, infrastructure development, recent complaints, including those by Tom London, as well as the preparedness by the sector and government to implement the National Health Insurance. Newzroom Afrika's Katlego is now joining us live from Braamfontein ahead of the briefing. Katlego, what's expected? What's on top of the agenda?
A very good morning, Aldrin. Indeed, we are set to hear from Denosa, Gauteng, about the state of healthcare facilities and the overall sector within the province in just a short while. And Denosa looking to highlight things in relation to the state of the health's finances. So are we using money wisely within the province in terms of the healthcare sector? Is money going where it's supposed to? As well as the infrastructure development. So do we have enough hospitals and clinics, and the ones that we do have is the upkeep in standard. And so Denosa Gauteng will also take us through the intake of nursing students in relation to patients. So patient and healthcare ratio, what does that look like? But also, as you rightly mentioned there, Aldrin, the recent weeks, the matter of Tom London, the broadcaster who found himself at the Helen Joseph Hospital outlining, distressing conditions that he experienced there, and putting that on social media, and then receiving donations for just up to 300,000 Rand, in which he was assisted, but highlighting that the issue at the Helen Joseph hospitals, but also hospitals throughout the province, and also highlighting the issue of particularly the attitude of healthcare professionals that he experienced there, really complaining about the attitude that he experienced there. But I do have with me the provincial chair of Denosa in Gauteng, Mr. Simphiwe Gada, to give us more. Mr. Gada, just take us through what we'll be hearing from you today.
Well, good morning to the viewers, and thank you for being here. Well, today, as the nurses organization in the province, will be reflecting around the issues that have been highlighted in the media out there. We felt the need that we must be able to come out as stakeholders in the sector, because what we have picked up is that there's a lot that is said and the blame being placed squarely on the doorstep of health, whereas we should be looking broadly into the Gauteng provincial government. For instance, one of the things that was in the media recently, we talk about the risk, the projection that by 2025 government finances in the province will collapse. But we are not saying, we are not talking about the unbudgeted pronouncements, bold pronouncements that have been made by government. Just to touch on one, let's talk about Nasi. Our view around that has been that, you drum up South Africans, you give hope, but I can tell you that that project, in our view, has not been entirely successful, because we gave hope to millions of youth in the province, but those processes have not yielded what they were supposed to yield, because what happened is that monies were shifted to accommodate these unbudgeted projects. The government plans over a 5-year period. We know that the premier of the province was David Makura. When he went out and the current premier came in to finish off that term, there was a plan that was in motion, and all those plans were kicked out as if there's a new political party that is in charge now, whereas it was the same. And then we saw many things that were unbudgeted being pronounced. You must ask, where does that money come from? Because if then Gauteng had that money, what about the other 8 provinces that did not do similar things? We also talk about, if we take you to the 2022 explosion at Tambo Memorial, we know that the DID came out pronouncing that 18 million would be needed to fix that, and that was fixed under 3 million. Who was the MEC of DID at the time? The same MEC that pronounced lately that health was collapsing the funds in the province. But we're not saying what was the money used for, because we as Denosa have been advocating that health must take over the infrastructure, and run infrastructure projects themselves. We know it's something that has not been well received, particularly by our colleagues at DIT. So we see all these things, and the unfortunate part is that South Africans, in particular the citizens of Gauteng, our view is that they are being misled, not the whole story is being told. So we're going to get into those issues, but also going to look at the 5 departments that have not performed. Out of the 5 departments, who was presiding over the 3? That is now conveniently forgotten. You know, what happened, the mess that was left there. But we'll also be talking about, we saw Samatu coming out saying that the whole management of the Gauteng Department of Health has got to be, removed. But they are not offering a solution and also saying why they should be removed. When Tom London is out saying that the attitude of doctors is not pleasant, the attitude of doctors is not showing Ubuntu. Samatu should be condemning that attitude and also highlighting what is their priority in terms of addressing that. They are quiet on that and nobody's talking about it. So we'll be touching on those issues. We'll also be touching, when we look into the future and the implementation of NHI, the workforce that we're going to need, in particular nurses, because it's our view that the R425 program that was scrapped, the infrastructure is there. We should reintroduce that program because it gave us a comprehensive cadre of a nurse that could respond to the nursing challenges. We talk about nurse specialists. Last year, we had about 200 nurse specialists that left this country. As things stand, you'll see that specialist posts for nurses, they always get advertised, but it's difficult to get candidates. What is the government planning? What is the response to that? Where are the funds? But also, during COVID, we had a special fund of COVID. We're not saying let's create a special fund where we're going to address the challenges of infrastructure in health, because if we rely on the same allocation that is given to health like any other department, we're not going to win. We're also not reflecting about the school that was built on the wetland in Maibuye Tembisa, which is also another wasteful expenditure. But we're very quick to talk about issues that we know the cause and the root. So we think that from where we are, 30 years into our democracy, with one political party that has been in charge of government, they must stop, using the citizens of Gauteng as a pawn in their chess game or their political game. And then they must stop undermining the good work that is done by our public servants, our nurses, our good doctors, our admin staff that are running hospitals, because the health system is standing precisely because of those workers. We are not recognizing the work that has been done by those workers. The only thing we do is to pronounce. But also, what we want to highlight on is that, in our view, there are certain mandates that rest with the National Department of Transport. But we hear Gauteng provincial government pronouncing, want to build a train. It's a mandate of national government, So those are the things we're going to highlight, things that waste the resources of Gauteng, because in our view, the resources we have, if used appropriately, they can address the needs of Gauteng citizens.
All right. Thank you so much for that, Mr. Gada. So we will be starting with that briefing at 11?
Yes, at 11 we'll begin.
Okay.
Thank you.
Thank you so much. So, Aldrin, you heard it there from Mr. Gada, the provincial chair, Denosa Gauteng, explaining there that certainly they will be outlining, their concerns about where budget is being spent and where, money is going in terms of maintaining the sector as well as infrastructure development. Certainly looking forward to that briefing starting in a short while.
Thank you so much, there, Katlego Sukhoto. Then, of course, we'll be taking you live to that press briefing in Braamfontein.